We have been talking to Dr. Khadijah Breathett, transplant specialist. And so we just want to thank you so much for your time, for just giving us knowledge on this sub specialized area of medicine that a lot of people do not know about. A lot of providers do not even know about, this aspect of medicine and pregnancy. So in this equitable distribution, what can make it better? What can a Black woman do to maybe improve her chances of getting a heart transplant if she has heart failure, in 2023 America?
Right. First, she has to be seen by a cardiologist. Second, it has to be seen by a heart failure transplant cardiologist at a site that actually does this and has expertise and experience with this are I think the first main things. And then the others are developing relationships with that team that provides the therapies and making sure that you understand what the different things are that you need to be ready, to be prepared and able to proceed. Unfortunately, it still is a big one, is having that social support, having that team. For a lot of these therapies at a lot of places, although it's variable depending on where you are, 24-hour care is sometimes required depending on what site you are at in the first several weeks, several months after a transplant or after a ventricular assist device. And that's often something that can be difficult to obtain for any person, but particularly if other family members are working. And so figuring out how to get those things, if that's required at your site, is really important. So I'd say the first thing is, you have a cardiologist that knows you have heart failure, that knows you're not getting better, to then see a heart failure transplant cardiologist to help do some additional tests and studies to find out if this is what's right for you and help prepare you, your family, your social support team to proceed with the best therapy for you.
And so as we're closing, can someone actually recover from heart failure?
So technically, I'd say it depends. It depends.
You sound like a lawyer now. It depends.
Because we know from prior studies that for patients, for example, we get you on these treatments, which we know work, which help improve the squeeze of your heart, help you live longer, help you stay out of the hospital. Sometimes it's hard if everything works, so you're better, everything's back to normal. Can you then just stop the medications? Can you just take them away? We know that that's not the right answer, because it often comes back and it's a devastating disease that can kill you. So if you can help keep things optimal at the best dose of therapies where you're doing well, you should maintain that. There are some other types of disease that may, depending on what the initial etiology was, it's possible that it may completely go away. For example, if it was due to infection or that has a brief time period, but it's a really hard, it's not a black or white type of decision. It's something you have to talk about with your healthcare professional, depending on what was the cause. Is it going to get better? What's the process of making it get better, to say that you have heart failure in recovery? But to say that it's truly cured, I'd say it's something that depends on the cause.
Wow. And, one of our final questions, when we had this podcast coming up, we put it to some of our clients and listeners. And what if your heart is just broken from love or lack of it? What is the situation there?
So broken from love or lack of love. Oh, that makes me
Yes.
so feel bad for you. Whoever the person is that had that question. But no, to be realistic for one, that gives me 2 points. One, depression, um, anxiety, a lot of those things come in tandem with having heart failure or any type of cardiovascular disease. So please, if you have any of those things, symptoms, depression, wanting to hurt yourself, or just the blues, please talk to your healthcare professional about it so that they can help you get set up with medications if needed, therapy, whatever to help keep you well. Because it's hard to also manage your heart issues if you're also not addressing the mental issues. So that's part one. Part two is is actually a type of heart failure that's kind of called broken heart syndrome. That's actually called Takotsubo, which is a little bit more common in women. It's usually induced by a stressful issue or stressful situation. And sometimes that can completely resolve. Oftentimes we'll say to still treat them the same as we would for other patients with heart failure by putting them on evidence-based treatments to make it get better. So it's a little bit, even though it sounds kind of like a joke with the question, some of that is real and has to be addressed appropriately.
Wow. We have been talking to Dr. Khadijah Breathett, transplant specialist. Can you just please give us a closing remark as we finish this very wonderful and iconic podcast today?
Sure. Thank you so much again for having me. And for all the listeners out there, this is a fantastic resource that has been brought to you, and I hope that you listen on the regular basis to get all of these wonderful tips that are being brought down by the Birth Center Foundation. But with last thoughts, I think some of the most important things I'd say, if you get from any of this, is to find somebody that listens to you, find a healthcare professional that gets you, that's going to listen to you when you have your symptoms, it's going to reassure you when it isn't anything, and then when they're not sure or it's consistent, that they're also going to look for what else it could be or refer you to someone that can help identify what it might be. And I think we have to do this if we're going to change our outcomes. And we know that when you have a healthcare professional that looks like you, and this is for underrepresented groups that are systematically mistreated, that you have better outcomes. But the fact of the matter is there's so few of us. It's less than 3% of cardiologists are Black, and I think it's less than 5% of physicians are Black. And I'm not sure quite of the statistics for advanced practice practitioners, but they are also, I believe, not good either. So you have to do the extra work to identify somebody that you trust, that's going to listen to you, that's going to let you know when they don't know, let you know when they need for you to see another expert to help answer your question and address your concern. And please feel empowered to do that. Please reach out. This is why we do what we do, and we really want for you to have your best life and have a healthy one.
Wow. Thank you so much, Dr. Khadijah Breathett, for coming to Cocoa Pods podcast.
Thank you.